Hi, I'm Dr. Kim Kinsler with Kinsler Psychology. Happy Mental Health Awareness Month. Today I'm going to discuss an article that I read in one of my online journals that I subscribe to called MedPage Today. And this article is entitled Mental Health Amid COVID-19, the Other Threat to Doctors' Lives. And this article was written by a medical student who's just headed off to residency. The article contained a lot of information that I thought was very concerning, and so that's why I'm bringing it to you today. As you may know, I am from a family of healthcare professionals, and I have a goddaughter who is heading off to medical school at FSU later this month. So my concern is definitely with some of the things that I saw in this article. The article quotes some statistics from the Journal of American Medicine, and one of the first things that stood out to me was that 1/3 of medical students and residents experience depression. And among that same group, 1 in 10 experience suicidal thoughts. That's a big deal. That means if there are 20 students in the room, 2 of them have thought about taking their own life. That's very scary to me. Another statistic that was reported in the article indicated that if you match medical students with their same age peers, the med students were 3 times as likely to die by suicide. And we know that medical school is stressful. We know that residency is stressful. We know that being a healthcare professional, particularly in this time of COVID-19, where we're seeing so many deaths all around us, and we're being inundated with this information in the news, we know that this is especially stressful. We expect it to be stressful, but we don't expect it to result in suicide. So that's one of the reasons that this article was so concerning to me. Now, there are a couple of things that can be done, as you know, in accordance with Mental Health Awareness Month. I want to leave you with some things that you can do, okay? The first thing is to get established with a mental health professional in your area. Fortunately, we offer telehealth services, so wherever you are, we're there too. If you have a laptop and a connection, we are available to assist you. A trained mental health provider will keep your information that is shared confidential, so you don't have to worry about that. Another thing that can be done is to set aside time to do those things that you feel good about, those things that make you feel good, whether it's exercising, yoga, talking on the phone, relaxing. Set aside time, even if it's as little as 30 minutes, to do something that you enjoy doing. Another thing is to reconnect spiritually. When individuals are going through situations or circumstances that appear overwhelming, it is very common to fall back on your spiritual beliefs. So reconnect spiritually. You could also create a mantra. The things that you say to yourself impact what happens out here. Create a mantra. If you say, I can do this, I will be okay, and you repeat that over and over, it becomes a part of your world. The things that happen here impact what happens outside of here. So you could create a mantra. Another thing, establish your support base. Know where your support base is, whether that's like-minded individuals who are not related. It could be family members, it could be friends. Know where your support base is, okay? You could also learn to compartmentalize. That's one of the benefits of professional therapy, learning how to separate this overwhelming thing over here from all of the rest of your world so that things don't bleed over. Learning to compartmentalize would definitely be key if you find yourself in that situation. Another thing is keeping the main thing the main thing. Knowing why you're doing what you're doing. What brought you here? Why did you choose this profession? Keep the main thing the main thing. Don't forget why. And I would say, above all, remember that this is temporary. Yes, it's very overwhelming. Yes, it's stressful. Things have changed interpersonally. We have quarantines, there's job loss. The global society has changed almost in an instant, but it's temporary. This too will pass. So if you find yourself in this situation, you find yourself overwhelmed, of course, we are indeed here to help. You can give us a call, you can reach out to us online or on social media. We're in the process of putting together a support group, a virtual support group for healthcare professionals. But above all, get help. Know that help is available to you. We are here to help. Happy Mental Health Awareness.